I'm Holly Stevens. I'm a nursing student, and this is 5 pounds of fat. Just 5 pounds of fat. Why do people think that they can just all of a sudden change their eating habit, like taking in more fruits and vegetables or cutting off junk food, but fail to do so every time? Is it because doctors have proven that there is a chemical release in the brain that causes an addiction to food, just as though a drug addict would be addicted to drugs? The answer is yes. But the power of the mind is much stronger, and when the risks are known, changes need to occur to increase one's lifespan. Working in a hospital setting, I have seen numerous cases of poor eating habits and what can occur. I've gathered information and research on diseases that can acquire from poor eating habits. Now I'll inform you on the increasing risk of this bad behavior. Knowing how to eat healthy and using preventative measures will greatly reduce the health risks. I will inform you about the chemicals that are released in your brain that cause addiction to food, diseases that occur with the bad eating habits, and proper techniques to prevent these diseases and risks. When there is an addiction, whether it to be sex, drugs, alcohol, thrills, or even to food, there is a specific chemical released in your brain that is a pleasure chemical. This makes addictive cravings and people want more. Studies show that eating high-fat foods actually makes people engorge on more amounts of high-fat foods, just as though a drug addict would engorge on a greater amount of drugs, as stated by Harmon. Dopamine is a neurotransmitter and it is the pleasure-filling chemical. Rewarding the sensation reinforces overeating and bad health habits, as stated by Harmon. If you thought being addicted to food was serious, you cannot imagine what it can cause by being overweight. It can cause diabetes, and this is where your pancreas stops creating insulin and doesn't break down your sugars correctly in your body, and this can lead up to amputation, as seen in this picture. It can cause cancer. Doctors have proven that numerous and various types of cancer have been led to poor eating habits. It can cause congestive heart failure, which is the inadequate blood flow to your body's organs, and it makes your heart pump inefficiently. It can cause pulmonary embolisms, which are, in some cases, fatal blockage of arteries. It can cause polycystic ovarian syndrome, and in females, this creates numerous cysts in the ovaries that burst and erupt further problems, as seen in this picture. It can cause gastroesophageal reflux disease, and this is where the acid from your stomach seeps up to your esophagus and erodes your esophagus and lungs. It can cause chronic renal failure, which is the kidneys stop ridding your body of waste, as seen in here. See the discoloration? It can cause a stroke, which is an inadequate blood supply to your brain, and it increases in people who are overweight. And it can cause gout, which is a buildup of uric acid within the blood, and it inhibits the nerve endings, causing severe pain, seen in this picture. There are numerous other diseases associated with being overweight, but these are the most common among Americans today, all which are stated in the Scientific Laboratory for Food Intolerance. The risks of being overweight are very apparent and real. Knowing the risks should cause great alarm, but there are ways that you can reduce the risks. The #1 cause of death in Americans is not by accident. It's heart disease, and this is encouraged by unhealthy eating habits, but it can be prevented. Risks will reduce if you follow these guidelines. Refrain from smoking, sustain a healthy weight, be involved in regular physical activity, consume healthy diet and food, control your blood pressure, manage cholesterol, keep glucose in your blood sugar at a healthy level, all which are stated in the American Heart Association. These guidelines are proven to reduce the risk and to increase your lifespan. Studies show that moderately overweight people have a 30% higher chance of premature death than that of a normal weight person. These prevention tips in changing your eating habits ultimately will save your life, as stated by Comer, page 263. It is obvious that eating right produces better health, but your body works hard and has to be treated correctly. You must change your eating habits and watch what you ingest because your health could deteriorate. Changing unhealthy eating habits and taking preventative measures will increase your lifespan. Chemicals released in the brain and disease lead to complications with being overweight, but preventative measures can be taken to prevent these issues from occurring. These tips are helpful as me as a nurse, but not only for me as a nurse, it helps any ordinary person. Just remember, if you cannot eat right, your health may give you a fright.